Tonight, a local man says he thinks he got COVID-19 after visiting a medical supply office. He tested positive shortly afterwards, and now he's at home recovering. An employee there also tested positive. Now, our Deshaun Brown spoke to the patient along with staff at that medical office. And Deshaun, you went through the timeline with both sides, and this man's story might expose some possible flaws in the testing and tracing process.
Yeah, Erica, the two sides do not agree on who should be responsible for notifying patients, but there was one obvious point they do both agree on, and that's it should not have taken as long as it did. Andrew Bodenheimer can pinpoint the moment he noticed his health begin to change.
So I was cooking dinner, and I lost my sense of taste and smell. And so then I sort of backtracked to, who had I encountered.
Bodenheimer tested positive for COVID-19 and through tracing efforts of his own, linked his possible exposure to a recent appointment at Carolina's Home Medical Equipment, a Matthews-based equipment provider.
I phoned inside, and they came out, they took my temperature. I had to wear a mask inside.
Bodenheimer says their protocols seemed fine. Due to the nature of his appointment, he and the staffer came into close personal contact. Even that seemed fine.
That's part of the risk that we take when we go to visit a doctor or a dentist or a medical professional.
This timeline helps to illustrate what happened next. The company CEO says one staffer felt sick the day after Bodenheimer's appointment. That Sunday, the employee got tested for coronavirus, and by Wednesday night, notified management they tested positive. The CEO says he notified the health department the next day.
And that they had been specifically told by the health department that they should not contact their customers. And that's where I have a real disconnect with their thought process on all of this.
Bodenheimer says he didn't know anything about the positive case until he experienced symptoms 1 week after his initial appointment. He says he got tested on his own. Even a look at state guidance puts the ownership on local health departments. First to notify the person who tested positive, determine their close contacts, then notify those contacts of the next steps. In an email, the company's CEO says he was also frustrated that relying on the health departments meant a patient of theirs would face this kind of delay.
I'm less upset with the fact that I was exposed to coronavirus. Obviously, I wish I wasn't. But I'm more so very, very, very upset over the fact that during the week that I was maybe asymptomatic or I was maybe spreading the disease, I was not quarantining myself, right? And that's really the issue here.
Now, Deshaun, that company CEO told you this has been a learning experience for them as well. Did he say what, if anything, they would do differently going forward?
Well, Erica, first of all, at this point, he says he's really not sure he can rely on the health department with a case like this. He mentioned that he did get a source of clarification as to why it was taking so long. And it really comes down to the lab. He said that right now it's taking anywhere between 2 days and 3 weeks for the lab to even get results to the health department. Back to you.
Okay, Deshaun, thank you.